Welcome back to Newt's World. I'm Newt Gingrich. This is the fifth and final episode in our series on how to win 2026. In the first episode, I argued that Republicans have an opportunity to make this election a choice between two futures. That means campaigning as a team with a common argument rather than 435 House campaigns and 33 Senate campaigns all talking about different things. The Democratic team is offering more big government socialism, more power in Washington, more control for bureaucracies, more radical values, and more dependence on large institutions that are already failing the people they're supposed to serve. The Republican team has to offer a practical alternative that is better for you, your family, and your country. Nowhere is that contrast more important or more personal than healthcare. Let me start with one number that explains why solving the question of how to create an affordable, health-oriented system is necessary. KFF, formerly known as the Kaiser Family Foundation, found that the average annual premium for job-based family coverage had reached $26,993. KFF Health News compared that to the price of a new Toyota Corolla hybrid. Think about that. Every year, a family is paying the price of a new car, not for all its health care, but for the insurance alone. Then come the deductibles, co-payments, medicines, and bills nobody can explain. Healthcare is also nearly 1/5 of the American economy. It is central to affordability, wages, the federal budget, and whether Americans live healthier and longer lives. We will do three things in this episode. First, explain the immediate choice between the two parties and why Republicans need a clear, positive healthcare platform. Second, show what President Trump and Republicans have done and are doing to lower costs, expand choices, hold powerful institutions accountable, and protect Medicare and Medicaid. Then, describe what still needs to be built. Republicans are putting important pieces of a person-centered healthcare system in place. Now we need to connect them so the system focuses on long-term care, not merely paying bills after people get sick. In short, we want to move from a sick care system to a health care system. The argument is simple. Republicans are helping Americans pay less, choose their doctors, and get more value today while building a healthcare system that can help people live healthier, longer lives at lower cost and with greater convenience tomorrow. Let's start with a choice between a Republican health future and a Democrat health future. For more than 15 years, Republicans have allowed the healthcare debate to be defined largely by what we oppose. We opposed Obamacare. We opposed government-run healthcare. We opposed Medicare for all. We opposed Washington bureaucrats making personal medical decisions. Those objections were valid, but opposition is not a platform. Voters have every right to ask, what are Republicans for? How will I pay less? Can I keep my doctor? Will my insurance be useful when I need it? Can we build a system that moves science from the laboratory to my house as rapidly as possible? We have to answer the concerns of voters directly. The Republican healthcare message should begin with 4 tangible commitments. First, coverage that fits your needs, not Washington's. Second, you choose the doctor, not the insurance company. Third, lower out-of-pocket costs and more value from your coverage. Fourth, protect Medicare and Medicaid by stopping fraud, thus extending the life of both programs. Those benefits can be understood in 15 seconds. They also reveal the basic difference between the two parties. The democratic model begins with government. Washington defines the insurance product and writes thousands of pages of rules. Washington sends enormous subsidies to insurance companies. Then patients are forced to accept the plans, networks, deductibles, and bureaucracies that result. After all that government control, millions of Americans still pay premiums for insurance with deductibles so high that they receive little value unless something terrible happens. They discover the specialist they need is outside the network. They wait for prior authorization. Months after care, they receive a surprisingly large bill for a price they never saw. This is the central contradiction of big government socialism. It promises to protect ordinary people from the rich and powerful. In practice, it builds a maze of rules that only the rich and powerful can master. Big insurance companies hire armies of compliance experts. Big hospital systems hire matching armies of compliance experts to argue with the insurance companies and buy independent practices and add facility fees. Pharmacy benefit managers negotiate discounts the patients may never see. Government agencies add more forms, codes, permissions, and delays. The patient is supposedly the reason the system exists. Yet all too often, the patient has the least information, the least power, and the fewest choices. Now, the big government socialist Democrats are going further. Candidates backed by the Democratic Socialists of America have won Democrat congressional primaries while campaigning for Medicare for All. Medicare for All is presented as an alternative to our current system. Properly understood, it is a more extreme version of the same problem. Today's system already gives too much power to government, insurance companies, hospital systems, and middlemen. Medicare for All would concentrate even more money and power in Washington. Instead of many large bureaucracies standing between the patient and the doctor, there would only be one enormous government bureaucracy setting the rules. That is not reform. It is the final centralization of a system that already gives the person too little power. A Democratic candidate back home may sound moderate. He or she may be likable. But that candidate is running to empower a Washington team whose instinct is always the same: regulate more, centralize more, and spend more. The result is greater government control over the choices families and doctors make. When Democrats defend Obamacare's Washington-designed plans, they are choosing the government product over the person's needs. When they embrace government-run health care, they choose political control over personal choice. And when they attack eligibility checks, provider verification, and efforts to stop suspicious payments as cuts, they choose the bureaucracy over the very people Medicare and Medicaid were created to help. Republicans should not defend every insurance company, hospital system, or corporate practice simply because it exists in the private sector. We should hold big insurance companies, hospital systems, and healthcare middlemen accountable when they hide prices, restrict choices, add unjustified fees, deny claims without explanation, or keep savings from reaching patients. The difference is that Republicans hold institutions accountable to empower people, not to replace one unaccountable bureaucracy with an even larger government bureaucracy. President Trump has given Republicans a national framework around which we can campaign as a team, the Great Health Care Plan. It is an important and ambitious effort, most of which I agree with completely. It calls for lower prescription drug prices, lower insurance premiums, greater accountability for big insurance companies, and real prices patients can see. It also calls for healthcare assistance to benefit eligible Americans directly instead of automatically enriching large insurance companies. That is the common sheet of music Republicans need. We can support the president's framework, explain its benefits in language every family understands, and add compatible reforms that move us toward a fully person-centered healthcare system. The immediate Republican promise should be clear. We are helping you pay less. We are expanding coverage that fits your needs. We are helping you use the value of your insurance with the doctor or hospital you choose. We are lowering prescription drug and routine out-of-pocket costs. We are helping Medicare and Medicaid survive by protecting them from fraud. And we are holding big insurance companies, hospital systems, and middlemen accountable when they put themselves ahead of patients. After the break, I'll walk through the facts, what Republicans have done and are doing, and what it means for actual patients. The best way to understand the Republican agenda is not by committee jurisdiction or bill number. It is by what changes for the patient. Will President Trump and Republicans' work in Washington pay off for you and your health situation? That is what really matters. Coverage that fits your needs. The first change is letting people buy coverage that fits their needs instead of forcing everyone into the same Washington design package. A healthy 28-year-old working in a restaurant, a family between jobs, and a self-employed parent in their 50s may need different things from their coverage. Their budgets are different, their risks are different, their doctors are different. Republicans are working to expand access to plans sold outside Obamacare with much lower premiums, in some cases, roughly half as much. These plans can offer broader access to doctors or lower deductibles by covering what a family values instead of every benefit Washington mandates. Democrats call these options junk insurance. I would turn that argument around. The real junk insurance is insurance you cannot afford, that makes you spend thousands of dollars before receiving value, and that excludes the doctors and hospitals you need. Every plan should explain in plain English what it covers and what it does not cover, and what you may owe. Then adults should be allowed to decide what provides value for their family. The Great Healthcare Plan would also stop automatically sending Obamacare assistance to insurance companies, and instead send it to eligible Americans. Republicans should let families use that help for the mix of coverage, direct primary care, medicines, and savings that works for them. Let the individual and the family, not the insurance lobbyist, lead the decisions about using health resources wisely. Democrats trust the institution. Republicans trust the person. The second change is restoring freedom to choose doctors and hospitals. Having an insurance card does not always mean having access to the doctor you need. Obamacare plans frequently use narrow networks. A leading specialist or major cancer center may be excluded. A trusted physician may even leave the network after a family enrolls. President Trump's administration finalized a new path for non-network plans. Instead of an insurance company deciding which doctors count, the plan states how much it will pay toward a covered service. You can apply that value to any doctor or hospital you choose. If the provider charges more, you may pay the difference. If the provider charges less, the plan should let you share in the savings, for example, by applying some or all of it to next month's premium. That's real choice. The value of your insurance does not disappear just because your doctor's outside a corporate network. A court has temporarily blocked this important change. Congress should now put the principle firmly into law. Your insurance should work with the doctor you choose. Choice also requires prices people can use. Before scheduled care, a patient should know three numbers: the total price, what the plan will pay, and what the patient will owe. That is why Congress should pass Senator Roger Marshall's Patients Deserve Price Tags Act. It requires real negotiated and cash prices, not vague estimates, from hospitals, imaging centers, laboratories, and surgical centers. It also gives employers the claims information they need to protect workers' money. The Senate Help Committee approved it 21-1. The full Senate should pass it, then the House should adopt it and pass it without weakening the requirement for real prices. The Great Healthcare Plan also calls for posting prices where patients can see them. Congresswoman Marionette Miller Meek's Prices on the Wall Act would require providers to display cash prices for services so people can schedule in advance. The House Energy and Commerce Committee has approved it, and the House should pass it. Prices on the Wall is a useful enhancement, not a replacement, for Patients Deserve Price Tags. A visible cash price at the doctor's office is powerful. Patients also need the full price before they arrive, the amount their plan will pay, and the amount they will owe. Employers still need access to claims data. We should pass both. The third change is helping families receive useful care before they have spent thousands of dollars meeting a deductible. Direct primary care gives a person or family an ongoing relationship with a doctor for a predictable monthly fee. The doctor spends more time knowing the patient and less time fighting with billing codes and insurance paperwork. The patient has a trusted doctor to call before a small problem becomes an emergency. Republicans delivered an important reform in the working families tax cuts. Starting in 2026, people can use health savings account dollars tax-free for qualifying direct primary care memberships. Republicans are also advancing the bipartisan Medicaid Primary Care Improvement Act. It would make clear that Medicaid programs can pay a monthly fee, so a beneficiary has an ongoing relationship with a direct primary care doctor. The broader Personalized Care Act would make health savings accounts available to many more Americans and allow the money to be used more flexibly. That larger reform is not yet passed, but the direction is clear. Help families combine coverage, primary care, medicine, and savings in the way that works best for them. The fourth change is making sure lower medicine prices reach the patient. President Trump's TrumpRx initiative deserves particular praise. It is not another coupon website. The President used the power of his office to secure direct arrangements with leading drug manufacturers. TrumpRx.gov gives Americans a visible price and a direct path to major savings on important medicines. Now we are seeing the results. New federal data show that prescription drug prices fell 3.1% over the last year, the largest annual decline since 1963. President Trump promised to bring prices down, challenged the drug companies, demanded most favored nation prices, and created TrumpRx. On his watch, prescription drug prices are finally moving in the right direction. It is a real break with the old system. It shows what medicine can cost when patients can deal more directly with manufacturers instead of being forced through layers of insurance and middlemen. Now Congress should make those savings work with insurance. Congressman Greg Murphy's Every Dollar Counts Act says that when a patient buys a covered medicine at a lowered cash price, that payment counts towards the deductible and out-of-pocket limit. If you save money for yourself and your health plan, you should not be punished for it. The same principle applies to pharmacy benefit managers. If a middleman negotiates a discount on your medicine, you should benefit at the pharmacy counter. Republicans passed major PBM reforms into law this year. They limit hidden compensation in Medicare, require rebates and discounts to flow back to the drug plan, and give plans better information for audits. That's progress. But a discount passed to the plan is not automatically a discount for the patient buying the medicine. Congress should finish the job by calculating the patient's cost from the lower price after the rebate. The bipartisan Pharmacist Fight Back in Medicare and Medicaid Act would do that in Medicare Part D. The Trump administration is also pressing for change. The Trump Federal Trade Commission has reached proposed settlements with Express Scripts and Caremark that would require them to offer plans that pass negotiated drug savings directly to patients at the pharmacy counter. The principle is simple. When the cash price is lower, take the cash price and count it toward the deductible. When a PBM negotiates a discount, the patient should see it at the counter. The fifth change is holding insurance companies, hospital systems, and middlemen accountable. The Great Healthcare Plan calls for a plain English insurance standard. A family should be able to see, in ordinary language, the premium, deductible, maximum out-of-pocket costs, covered services, exclusions, doctor restrictions, and prior authorization rules. Insurance companies should also disclose how much premium money goes to claims instead of overhead and profit, how often they deny claims, and how long patients wait. The House Energy and Commerce Committee has advanced much of this approach in its expanded Lower Cost, More Transparency Act. The package includes standardized, plain language insurance information, disclosure of how premium dollars are spent, and greater reporting on denials and delays. The House should pass it, and the Senate should act. Republicans are also attacking unfair hospital billing. If you see the same doctor in the same office for the same service, your bill should not explode because a large hospital system bought the practice and added a facility fee. Employers need accountability too. Many large employers pay workers' medical claims directly, while an insurance company or another administrator processes the bills. Yet, most employers cannot see enough of the underlying data to check whether prices are right, discounts were applied, or fees are hidden. Healthcare benefits are part of a worker's pay. Hidden costs leave less room for wages, retirement savings, and take-home pay. The Patients Deserve Price Tags Act gives employers the data and audit rights needed to protect that money. The sixth change is protecting Medicare and Medicaid from fraud and improper payments. Verify that the person receiving a benefit remains eligible. Check citizenship or legal status where the law requires it. Confirm income. Make sure the same person is not improperly enrolled in several states. Verify that a provider is real, qualified, and actually delivered the service. Democrats attack these safeguards as cuts. That is exactly backward. Every dollar sent to a criminal, fake provider, deceased enrollee, or someone no longer eligible is a dollar taken away from legitimate care. It cannot help a senior, person with a disability, a low-income child, or a family in crisis. The Working Families Tax Cuts strengthened eligibility checks, acted against duplicate enrollment, required checks for decreased enrollees and providers, and protected federal Medicaid dollars for people who are legally eligible. It also established work, education, or community engagement requirements for certain able-bodied working-age adults. The law protects people who are medically frail, caring for children, or disabled family members receiving addiction treatment or facing other hardships. The lesson of welfare reform is that work and education are central to independence, dignity, and long-term well-being. Compassion should help people move forward when they're able and protect those who truly cannot work. The bottom line is this: stopping fraud is not cutting care. It is protecting care. The Working Families Tax Cuts also close a Medicaid financing loophole. Some states use special taxes and payment arrangements to bring in more federal money, creating incentives for healthcare providers to charge higher prices throughout the system. HHS projects that these reforms could lower prices outside Medicaid by as much as 3.5% and save families, employers, Medicare, and other payers between $502 billion and $875 billion over the next decade. That is serious reform, protect Medicaid, stop rewarding higher prices, and lower costs for everyone. Republicans are also helping to bring care closer to people, especially rural Americans who may live hours from a specialist or hospital. The Working Families Tax Cuts created the Rural Health Transformation Program, $50 billion over 5 years to strengthen rural health care in every state. States are using it to expand primary care, strengthen the rural workforce, improve chronic disease care, modernize facilities, and bring digital tools and remote care to rural patients. Congress has also protected telehealth before the deductible for health plans with health savings accounts and continued hospital care at home through 2030. These policies matter everywhere, but they can be life-changing in a rural community where distance is itself a barrier to care. The goal should not be simply to keep every old structure exactly as it is. It should be to make sure rural Americans can reach dependable primary care, emergency care, specialists, medicines, and long-term support in person when necessary and remotely when that works better. Finally, President Trump and Secretary Kennedy are beginning a major shift from paying for sickness to promoting health. The Make America Healthy Again movement has put chronic disease, food, exercise, and prevention at the center of the national conversation. The new dietary guidelines restored the food pyramid with a simple message: eat real food. They emphasize whole, nutrient-dense foods and call for reducing highly processed foods, added sugars, and refined carbohydrates. The administration has also asked hospitals to serve healthier food, propose stronger disclosure when companies decide an ingredient is generally recognized as safe, and move toward the first federal definition of ultra-processed food. Congress is reinforcing this direction. The House Energy and Commerce Committee advanced legislation to strengthen nutrition education and chronic disease prevention in community health centers, which are especially important in rural and underserved areas. These are positive steps. They're also the bridge to the larger reform America needs. Republicans are expanding choice, making prices visible, supporting direct primary care, protecting rural access, and focusing on prevention. After the break, I want to explain what still must be built to connect these pieces into a person-centered healthcare system. For most of the modern era, American health policy is focused on one question: who pays the bill after somebody gets sick? The employer, the insurance company, Medicare, Medicaid, the patient, the federal government. Those questions matter, but they're not the same as asking how to keep people healthy. Insurance is not healthcare, and healthcare is not health. If Republicans want to become the party of a healthier America, we have to ask a different question. What kind of system helps each person live the longest, healthiest life possible at the lowest cost and with the greatest convenience? That leads to what I call a person-centered healthcare system. We say person-centered, not patient-centered, for a reason. Hopefully, most of us spend very little of our lives as patients, but we spend every minute as people. Our health is shaped at home, at work, at school, at the grocery store, and in our daily habits long before we enter a doctor's office. Person-centered care means listening to the individual, treating the whole person, and understanding that person's life instead of reducing him or her to a diagnosis. Dedicated doctors and nurses try to deliver that kind of care today, but they're working inside a system organized around institutions rather than people. The insurer has one part of the record. The hospital as another. The primary care doctor, specialist, pharmacy, laboratory, wearable device, family caregiver, and social service organization may each have another. Important facts about sleep, food, activity, stress, housing, or family history may never enter the healthcare system at all. That is why person-centered care requires a person-centered healthcare system to support it. President Trump and Republicans are building important pieces. The next task is to connect them and complete the system. First, every American should be able to own and securely control a complete health record that follows them throughout life. Today, records are trapped in fragments. Change jobs, move, switch insurance, see a new specialist, or visit an emergency room while traveling, and the doctor may be working with an incomplete picture. That can mean a repeated test, a missed drug interaction, or a delayed diagnosis. A complete record should bring together medical history, medicines, images, lab results, allergies, genetics, and family history. When the person chooses, it should also include information from home devices, wearables, nutrition programs, caregivers, and relevant social services. The hospital should not own your history. The insurance company should not own it. The government should not own it. You should own your own history. Artificial intelligence can help organize the information and spot a change that deserves attention. But the person remains in control. Technology should strengthen human judgment, not replace it. The second missing piece is a system that helps people act before illness becomes a crisis. The MAHA movement is right to focus on food, exercise, and the root causes of chronic disease. But advice alone is not enough. People need a system that helps turn daily information into useful action. With a person's permission, changes in sleep, movement, heart rhythm, blood sugar, voice, memory, and other signals can help that person and a trusted doctor spot trouble earlier. Smart watches can flag possible irregular heart rhythms. Glucose monitors show how food, sleep, medicine, and activity affect blood sugar. Researchers are studying whether changes in voice and movement can help identify Parkinson's earlier, and whether changes in sleep and daily behavior can help spot cognitive decline. The most immediate example may be Alzheimer's disease. New blood tests are making it possible to identify signs of Alzheimer's earlier and more easily. The Bipartisan Alzheimer's Screening and Prevention Act, the ASAP Act, would create a Medicare pathway to cover approved blood-based tests for early detection. Congress should pass it. Earlier detection gives families more time to seek treatment, improve daily habits where useful, join research, organize support, and plan. It also matters because many future treatments may work best before extensive damage occurs. Our America's New Majority Project polling found that 81% of Americans prefer a system focused on keeping people healthy instead of mainly treating them after they get sick. 97% say finding health problems earlier is important. The public understands the goal. The system must now deliver it. Of course, earlier detection matters only if it leads to better prevention, treatment, or decisions. America leads the world in biotechnology, medicines, medical devices, diagnostics, and artificial intelligence. But a breakthrough does not improve a life if it remains stuck in a research center, delayed by government, excluded from coverage, or unavailable to a doctor. A person-centered system should make it easier to find appropriate clinical trials, match people to new treatments, update care as evidence changes, and learn from results while protecting privacy. We should modernize clinical trials so more people can take part closer to home. That is especially important in rural America, where distance from a major medical center can shut people out of cutting-edge research and specialty care. The goal is not simply to detect disease earlier. It is to treat it better, prevent complications, restore function, and help people remain healthy and independent as long as possible. Fourth is a genuinely simpler system. Plain English explanations are essential, and the great healthcare plan is right to demand them. But explaining a maze in simpler words does not eliminate the maze. We need to simplify the system itself. Americans should not need a graduate degree to understand a bill. Doctors should not spend hours fighting prior authorization and insurance paperwork. Patients should not provide the same information again and again because institutions cannot communicate. Employers should not need lawsuits to see the claims they pay. Modern technology can settle claims faster, reduce repeated paperwork, and take routine tasks away from doctors. Common standards can help information move securely without forcing everyone into the same government computer system. Complexity is not harmless. It hides inflated bills, errors, duplicate services, hidden fees, and conflicts of interest. It gives powerful institutions more chances to profit from confusion. Every hour a doctor spends serving the bureaucracy is an hour not spent caring for people. A person-centered system should be simple by design, not merely complicated in plain English. The fifth missing piece is healthcare organized closer to the people it serves. Americans are frustrated that decisions about doctors, records, prices, and care are made by distant corporations, national insurers, consolidated hospital systems, and government agencies. Our polling found strong support for healthcare organizations that are locally owned or operated and accountable to patients and communities. This is especially important in rural America. A distant bureaucracy may see a small town as a line on a spreadsheet. A locally accountable organization knows whether the county has an obstetrician, whether the pharmacy may close, how far families travel for cancer care, and whether broadband is reliable enough for telehealth. The new Rural Health Transformation Program should become a proving ground for person-centered healthcare, strong local primary care, regional specialty support, telehealth, home-based care, complete records, chronic disease prevention, and clear responsibility for results. Local organizations should not control the patient's record, choices, or prices. The person should control the record. The person should choose the doctor. Prices should be visible. The local organization's job is to coordinate, support, and answer for results. Finally, we must change what we count as success. The current system measures transactions, admissions, procedures, claims, codes, prescriptions, and dollars spent. A long-term health system must ask different questions. Is diabetes under control? Was cancer caught earlier? Was a stroke prevented? Did an older American remain independent? Did a rural patient receive care without driving 3 hours? Is the person's life actually better? These measures should help people and doctors learn. They should not become another rigid government formula. Put the pieces together, and a coherent Republican vision emerges. Some pieces are already being built. More coverage choices, portable savings, direct primary care, care at home, real prices, doctor choice, rural investment, MAHA's focus on prevention and accountability for powerful institutions. The remaining work is clear. Give each person a complete, lifelong health record. Turn daily information into earlier action. Bring innovation into care faster. remove needless complexity, restore local accountability, and measure whether people are actually healthier. That is how a person-centered healthcare system makes person-centered care possible. And that is the opposite of big government socialism. The Democrats' instinct is to centralize decisions and standardize people. A Republican person-centered system recognizes that people and circumstances are different. The best decisions are usually made close to the person, with good information, real choices, honest prices, and a trusted doctor. Government has important jobs. It must fight fraud, enforce honest disclosure, help people who need assistance, support basic science and public health, and prevent powerful institutions from trapping patients. The government should serve the person. Person should not serve the system. Let me bring this back to the campaign argument from the beginning of this series. The 2026 election should be a national choice between two teams and two futures. The Democratic future is big government socialism applied to health care, more centralized decisions, more Washington-designed insurance, and more power for bureaucracies. Medicare for All would complete the process by concentrating health care money and decision-making in Washington. The Republican future begins with tangible benefits. Coverage that fits your needs, not Washington's. You choose the doctor, not the insurance company. Lower out-of-pocket costs and more value from your coverage. Medicare and Medicaid protected by stopping fraud. Big insurance companies, hospital systems, and middlemen held accountable when they hide prices, restrict choices, or keep savings from patients. President Trump's great health care plan gives Republicans an important national framework. Republicans have enacted important pieces. They are advancing more, and they should campaign together on completing the work. The larger opportunity goes beyond making today's system less expensive and less frustrating. America can build a person-centered healthcare system organized around each individual's long-term health. It can connect daily information to earlier action and give people control of their records. It can bring science into care faster, simplify the system, strengthen rural care, and hold institutions accountable. That is how healthcare becomes part of the Republican affordability agenda. That is how healthcare becomes part of the Republican innovation agenda. And that is how the Republican Party becomes the party of a healthier America. The closing argument is straightforward. Republicans are helping you pay less, give you more choices, and get greater value today. At the same time, we are building a person-centered healthcare system that can help your family live a healthier, longer life. Democrats are defending a system that costs more, limits choices, strengthens bureaucracies, and waits until you're sick to take your health seriously. Their big government socialist approach wants to put even more of the system under government control. That is the choice between the two parties and the two futures this November. This has been our 5-part series on how to win 2026. Newt's World is produced by Gingrich 360 and iHeartMedia. Our executive producer is Garnsey Sloan. Our researcher is Rachel Peterson. Special thanks to the team at Gingrich 360. If you've been enjoying Newt's World, I hope you'll go to Apple Podcasts and both rate us with 5 stars and give us a review so others can learn what it's all about. Join me on Substack at gingrich360.net. I'm Newt Gingrich. This is Newt's World.